Good afternoon, everyone. Welcome to Yashoda Hospitals International Nursing Pro Quiz 2022. Is being hosted by me. I am Dr. Amar, AVP Yashoda Hospitals. We appreciate your participation in today's live, entirely online quiz on Facebook. We all know that, like, for this quiz, we got a lot of good. Many people are participating into this. More than 400 groups from colleges, different colleges and hospitals have been enrolled from different places, different states and countries. We also received registration from different countries like United Kingdom, Australia, Africa, Saudi Arabia, Egypt, Bahrain, Kuwait, Nigeria, and in India, almost we cover almost all the states, 24 states. Most of the people participating in each and every state in India as well. So I welcome you all for today's quiz. And we all know this is the last week of the year, and this is the year of joy and happiness, because we all know this is the week for Christmas and coming nearing the new year with the same excitement. So we'll go for the today's quiz, and with this quiz comes with the exciting prizes. Would like to conduct this type of quiz every month once. Do like the Yashoda face, or get the update, be updated on the Yashoda Facebook. The today's quiz consists of 3 rounds, and first round will be basic nursing procedures. Second round, advanced nursing procedures, and third round will be fluid calculations, drug and fluid calculations. So with the same spirit, we'll start this quiz competition, and would like to add one more thing. There will be time limit for this. It will be like a rapid fire and time bonded. So time also will be showing onto the clock, and 6 questions each round it will be covered, 5 plus 1. So these basics points, again, Pratusha will orient you before starting this. Any doubts, anything, please clarify before starting the session. Pratusha, please take over and start the webinar.
Hello, namaste, vanakkam, and sat shri akal. So welcome to the first International Nursing Pro Quiz Contest 2022 from Yashoda Hospitals. So let me share you the screen first. I want to show you how many participants are here to join this quiz. So we have almost 117. So we are locking up the system as of now. The rest can't join. So we are locking it now. Still people are joining. So we couldn't able to do it. So we are just trying to start. So welcome to the International Nursing Pro Quiz semi-finals, which we are conducting from Yashoda Hospitals. So you will be excited to know about all of the 3 rounds, and let us see what is there for you now. Are you ready for the challenge? If you're ready for the challenge, please do say us whether you are super excited or excited. By just marking your polls, we just wanted to know whether you're super excited or excited. Wow. So if you are excited, and most of you are super excited. So let us start our first round. So it is about the basic nursing procedures, where we will have 1 minute time for you for answering the questions. Before answering, make sure you will read all the options. I will be here to read up the question, also the options for you. So let us start. Are you ready? Great. Here is the first question for you. Identify the given image of oxygen delivery device. Option A, simple face mask. Option B, non-rebreather mask. Option C, venturi mask. Option D, partial rebreather mask. You have just got 40 seconds to answer this question. I'll read up the options for you. Identify the image which is being given here. And the options are simple face mask, non-rebreather mask is B, C is venturi mask, and D is partial rebreather mask. Select the best option among this. Identify the image. By just seeing the image, you can just see which one will be putting the best out of it. I can see almost 79, 80, 82 members are answering this question. Great going. Good, good. We have just 1 second to answer this question. Let me show you who have answered correctly. 66 out of this have correctly answered this question. Let me show you the scoreboard. So this will be super exciting for us. So Great Kitten is on the top score and Green Jaguar is on the second. You can see your scores here. So let me show you the rationale behind this. And the answer for the first question is Venturi mask. And the Venturi mask is a high flow device that provides a fixed concentration of oxygen. So let us go back to the second question. So here again, you have got 1 minute to answer this question. And the question is, an increase in elderly patients' systolic pressure is due to what? So, and the options are A, increased vessel flexibility. Option B, decreased vessel elasticity. Option C, enlarged vessel dexterity. Option D is diminished vessel porosity. What do you think would better fit for this question? And what would be your answer? Again, I'll repeat the question for you. An increase in elderly patients' systolic pressure is due to what? Especially we are talking about the elderly patients. So choose the best answer. You have just got 15 seconds to answer this question. After this, you cannot have time to answer again. Select the best options out of it. Great, people are doing it. Awesome, awesome. 1 second and 0. So let us see how many have answered correctly. 44 out of this have answered correctly. Let me show you the scoreboard who is on the top again. Oh God, sorry. Again, the Great Kitten has gone out and Legend Raven has come onto the top. Let me see what is, show you what is the answer and the rationale. For the question 2, we have got the answer is B, that is decreased vessel elasticity. Why? It is because the vascular system changes with age. Also, the arteries get stiffer, causing the blood pressure to go up. That's why the answer is decreased vessel elasticity. Let us go back to the third question, which is a puzzle. Here, you just need to select and just move the options up and down to make it as a sequence. The question here is, make sure that you will arrange the donning of personal protective equipment, which is also called as PPE, in the sequence. And you have got goggles, mask, gowns, gloves, mask, gown, gloves. So whatever you think, you have got just 30 seconds more to answer this question. You just need to move the options up and down to make sure that the puzzle will come and fit according to the sequence which we have got for personal protective equipment. Make sure that you will arrange all that in order. You just need to click and just drag it down to make sure that the sequence will be correct. We're not talking about the doffing, we are talking about donning here. So what is the sequence? We have just got 5 seconds more to answer this. Most of you have answered the question. Congratulations, we have got 0 seconds more. Yes, great. So 76 out of this have answered correctly. Well done, team. Great. And now let me show you the sequence of this. Okay. Before this, the Legend Raven again is on the top scoreboard. Congratulations. And the answer is, for the third question, gown, mask, goggles, and gloves is a sequence how we do the donning. So coming to the next question, again, you have got 1 minute to answer this question. So before this, let us read what is there for you. The accidental leakage of non-vesicant solutions out of the vein into the surrounding tissue is known as what? Again, I'll repeat the question for you. Accidental leakage of non-vesicant solutions out of the vein into the surrounding tissues is known as what? A. Option A is phlebitis. Option B is infiltration. Option C is extravasation. Option D is hematoma. So what do you think that the best answer would be? You have just got again half minute more to answer this question. Think about leakage of non-vesicant solutions out of the vein into the surrounding tissues is known as what? Option A is phlebitis. Option B is infiltration. Option C is extravasation. Option D is hematoma. What do you think that the best answer would be? You just got only 2 seconds to answer this question. Again, we're just going out of the time. Great. So out of this, 48 have answered it correctly. Congratulations for the 48 top. Let us see the scoreboard again. Yes, amazing. Yelk is on the first and the second scoreboard goes to Honest Panther. Great. Good going, team. So this is the answer. That is for the fourth question. Infiltration is the answer because the accidental leakage of non-vesicant solutions out of the vein into the surrounding tissues will be just nothing but infiltration. Great. Let us do the fifth question. Following are the steps in the adult chain of survival. So you can just see the image and you can think about CPR, and we are talking about the adult chain of survival, where you need to see out of these options which will be exceptional. Option A, early CPR, that is cardiopulmonary resuscitation. B, rapid defibrillation. Option C, advanced airway placement. And option D, integrated post-cardiac arrest care. So what do you think out of this, except the adult chain of survival includes? Is it A, is it option B, C, or D? Which one do you think is the best answer for this? So let me repeat the question for you again. Following are the steps in the adult chain of survival. Among this, which is the exceptional one, which doesn't include in this? Okay, we are time up, like 17 have answered it correctly out of this. That's why I will just keep on repeating except. So let me show you the scoreboard first, then I will try to tell you the rationale. Honest Panther, again, congratulations, you are on the top scoreboard. So the answer is advanced airway placement, because the chain of survival consists of all of that which we have discussed, as the CPR provides the oxygen to the brain and to the vital organs, which increases the likelihood of recovery. Rapid defibrillation increases the chance of effectively restoring a normal heart rhythm. And advanced placement will not come as a part of PLS. Great. So let us see a double point question, which is final in this round. Rapid administration of blood containing citrate causes what? I repeat the question. Rapid administration of blood containing citrate causes what? So if you're trying to administer the blood and you're trying to transfuse the blood, what would be the best option out of this? So option A, hypokalemia. Option B, hyperkalemia. Option C, hypocalcemia. Option D is hypercalcemia. So read the options again and just try to see, in case if the person is having a rapid administration of blood, which is containing citrate, do causes what? Is it hyperkalemia, hypokalemia, hypocalcemia, or hypercalcemia? Which one among this is your best fit for the question? You have just got 4 seconds to answer this question. Most of you have answered this. And the time is up. Yes, we have got 58 correct answers for this. And congratulations, the answer is C, that is hypocalcemia. Who is on the top scorer? Again, the amazing elk has woken up from the sleep. So he's on the top board and the wise bear is on the second. Great. Why the hypocalcemia is the answer? Because citrate binds the patient's calcium when the blood products are administered, so rendering the calcium inactive. So as a result of this, the undesirable physiological effect occurs. That is where you can see hypocalcemia as an answer. Great. Let us go back to the round 2. So make sure, again, you will have the timer again will try to increase or decrease according to the complexity of the questions. So make sure your fastest finger will be on the top score, okay? I know you might be answering correct, but the thing is here you need to use your brainstorming to answer it correctly. So the round 2 consists of the advanced nursing procedures. So let me show you the first question again. Fastest finger first, you have to do the multi-select here. And the question says, what is the BECK'S TRIAD includes? You can select multiple answers, not one answer, because answers will be one or multiple. So you have to select the answers which are applicable for this. So make sure which will be your best option. Option A is low blood pressure. Option B is distension of jugular veins. Option C is high blood pressure. And option D is muffled heart sounds. What does BECK'S TRIAD includes? select multiple options, not one option. I'm just again trying to say you select multiple options among this. Which one would be your best answer? Again, I'll repeat the options for you. Option A, low blood pressure. Option B, distension of jugular veins. Option C, high blood pressure. Option D, muffled heart sounds. Which one is your best answer? And the time is up again. Great. So we have got 70 people right for this question and 68 people only for few. Okay, let me show you the scoreboard because I said you multiple options you are supposed to select. On to the top scorer, we have got Amazing Elk again on the top and Legend Raven is on the second place. Great, good going. So answer is A, B, and D, where the three medical signs associated with acute cardiac tamponade, which you can see here. And here we include the low blood pressure, distension of the jugular veins, and muffled heart sounds. These are the three main signs that you can observe in the Beck's trait. Great. So let us go back to the second question in the round 2. So here we are talking about the ABG. Again, you have got minutes of time. So here is 1 minute of time to interpret this ABG. The ABG shows the pH is 7.3, PaCO2, that is carbon dioxide, is 68 mmHg, HCO3 is 28 millimolecules per liter, and PaCO2 is 60 mmHg. How would you interpret this? So you just need to mark what is the pH, what is the PaCO2, and what is HCO3. And among this, you have to just decide among the options. And the options are option A, respiratory acidosis, which is uncompensated. B, option B is respiratory acidosis, partially compensated. Option C, metabolic alkalosis, which is uncompensated. And option D, metabolic acidosis, which is partially compensated. So please check with your pH, PCO2, and HCO3, then answer the question. And the time is up again. Now let us see, 43 have answered it correctly. Congratulations to the 43. Let me show you the scoreboard again. The Amazing Elk is again on the top. Smoothie Valby again came to the second position, and Polite Cat is on third, and Sturdy Elephant is on fourth. Green Leopard is on fifth. Great, good going. Yes, the answer is B, respiratory acidosis, which is partially compensated with metabolic alkalosis. So here the pH is 7.3, that is why it is acidic, and PaCO2 is 68, that's why it is acidic. Again, pH and PCO2 are both in acidic, that is why it is respiratory acidosis. And whereas HCO3 is coming into alkalosis, that is why it is partially compensated with metabolic alkalosis. This is our answer. Great. Let me show you the next question. Fastest finger first again. So here you have got the question about the GCS. Make sure you will brainstorm much about the question again. And we have given you the GCS scale for your easy understanding of the EVM score. So let us look at the question. The patient looks spontaneous when you speak to the patient. Means he just opens his eyes. And you ask the date, and the patient answers it as blue, and noted left-sided weakness when you have just checked with a motor. So this is how you got the question, and you have got the GCS scale here, and the options are the I score is 2, and the verbal score is 3, motor 5, and the GCS is totally 10 in the option A. So let's see option B, the GCS is 13. Here the I score is 4, and the verbal response is 3, and the motor response is 6. So let's see option C, I is 2, verbal is 1, and motor is 5. Again, option D is I is 4, verbal 5, and motor 6. So how many have answered correctly? Great, good going. It's 50 have answered it correctly. Superb. So let us see the scoreboard. Yes, great, amazing. Yelk is again on the top board, and Polite Cat again came up to the second position. And Sturdy Top Elephant has come to the third position. Great, good going. So this is our answer. The I response is 4, verbal response is 3, motor response is 6. The total GCS is 13. Again, when you look spontaneously, as we said in the question, it is E4. And when you ask the date, as a person couldn't able to answer it in the words, in the sentences, and they're trying to only use blue, means the score will be V3. And you noted that the left-sided weakness is there. Only weakness is here. It's not that the patient is not responding. That's why it is normal. That's why we have given a score of M6 and the GCS is 13. Great going, team. And let us have the next question for you. It's about the arterial line. And you have got again 1 minute to answer this question. You can see the question as the transducer of the arterial line should be leveled up at. Again, I'll read the question for you. The transducer of the arterial line should be leveled at what? And the option A is longitudinal axis. Option B, phlebostatic axis. Option C, medial axis. And option D, central venous axis. So I'll read the question for you again. The transducer of the arterial line should be leveled at what? Is it longitudinal axis? Is it phlebostatic axis, or medial axis, or central venous axis? Which option do you think that is the best? So you have just got 5 seconds to answer this question. Most of the people have answered it. 93, 95, 96, I can see. Yes, again, the time is up. And now 29 out of this have answered it correctly. Congratulations for the rarest 29. Great, good going. So really sorry, amazing Yelp again gone back to the third place. Polite cat is on the top and sturdy elephant is on the second. Great going. Don't get demotivated. You're going to do great. Yes, the answer is phlebostatic axis, because we have to secure the transducer at the level of phlebostatic axis. Why? Because it will ensure the pressure readings accurately. And here, the phlebostatic axis is found at the intersection of the fourth intercostal space and the mid-axillary line. That's where we are trying to fix it up at the phlebostatic axis. So let us go back to the next question. Ready for this? So the fastest finger first again. So we are talking about the mean arterial pressure. So the question is, what is the mean arterial pressure? How do we measure it? By dividing systolic and diastolic blood pressure with what? So here we are trying to talk about the MAP formula, that is mean arterial pressure. So what would be your best option out of this? And the option A is 2, option B is 3, option C is 4, option D is 5. So what do you think that the MAP can be divided with what? So either it is systolic and diastolic pressure, with what you divide this. So what is the MAP formula exactly? Why do we check MAP? So, and you have got 15 seconds to answer this question. Fastest finger first again. You should not lose your score. Even though you answered it correctly, but still you have to make sure that within the timer, you have to keep your answers. And the time is up again. Yes, out of this, 47 has answered wrong and 39 have answered it correctly. Great. It is, the answer is B. So again, come on, amazing Yelp is on the top and the polite cat is again on the second score. Great going. And the answer is B3. So here I am trying to show you the formula. The mean arterial pressure, normal mean arterial pressure should be, the normal range is 70 to 110 mmHg. And the average MAP of the average pressure of the arteries will be calculated by using this mean MAP formula. Here the MAP formula is 2 multiplied by diastolic blood pressure plus systolic blood pressure, whole divided by 3. And MAP is multiplied by 2 because the diastolic phase lasts longer than the systolic phase. That is why this is the answer. And for this question, if the BP is 120 by 75, then the MAP would be 90 mmHg. So this we made it just for you as an example. So let us get back to the question again. So here you will again gain the double points here. Make sure you will just score it a bit. So the question is, cuff pressure of the ET tube is maintained at what pressure? Okay, I'll repeat the question for you. Cuff pressure of the ET tube, that is endotracheal tube, is maintained at what? So the options are option A, 30 to 60 centimeters H2O. Option B, 10 to 30 centimeters H2O. Option C, 15 to 20 centimeters H2O. And option D, 20 to 30 centimeters H2O. So what do you think that the best option would be among this? To identify the cuff pressure of the ET tube, what is the common pressure or the normal pressure that we need to maintain? So whenever we check for this pressure, we need to see that it would be accurate and normal. So what do you think that the cuff pressure would be? And the time is again up. Great, people have answered it. So great going. And the 76 have answered it correctly out of this. Who was on the top again? So congratulations, amazing. Yalk is playing really well. And the sturdy elephant again gained the second position. Congratulations. And the answer is D, that is 20 to 30 centimeters H2O, because maintaining cuff pressure at this level will prevent the tube misplacement or displacement. Great. Let us get back to the next question. How we have got into the final round. Hope everybody would be enjoying. Let us know even in the Facebook live comment section that you are enjoying this game so that we can come up with more of this quiz in the future. So the round 3 is talking about drug and fluid calculations. Here we go about it. So make sure before this, I'm just going to give you some instructions. Make sure you will have your pen and paper with you. Also, you need to have your calculators ready. Just by saying the question, you need to immediately calculate it because you will have a time limit for this. So sure that everything will be ready. Here's your first question. I'll read the question for you. It is talking about the heparin and about how much ml would you administer. So here is the question. The doctor ordered 7,500 units of heparin, which is available as 10,000 units per ml. How much will you administer? Means how much ml would you administer? So I'll read the question for you again. The doctor's ordered dose is 7,500 units of heparin, which is available in the stock, means in the pharmacy or in the stock, as 10,000 units per ml. How much ml will you administer? So the options are option A, 0.2 ml, option B, 0.4 ml, and option C, 0.5 ml, and option D is 0.7 ml. Make sure you will try to apply the formula so that you will get the right answer out of this. Most of you people are answering. Out of 78 people have answered it correctly. Great going. Even in Facebook, people are answering. Good, good, good. Amazing. We have just got 19 seconds, 15 seconds again to answer this question. Which is the best output out of this options? Either it is option A, 0.2 ml, 0.4 ml, 0.7 ml, 0.5 ml, and the time is again up. So here is the option A, D is the right answer. We have got 0.7 ml, and most of you have answered it correctly. Let us see the scoreboard. Yes, amazing. Yalk is again on the top position. Make sure again the sturdy elephant, polite cat, and great eagle, green leopard will top the position. Come on, team. So here is the answer. So the answer is 0.7 ml. The D is the option. And required, the formula which we have applied here is required dose divided by stock dose multiplied by stock volume divided by 1. Here the required dose is 7,500 units and the stock dose is 10,000 units per ml. Per ml is nothing but 1 ml. So the stock volume is 1 ml. And the answer is 0.7 ml. Great. Congratulations, those who have answered correctly. Yes, all the best for those who wanted to answer it more. So the next question comes here. And the question is, the doctor advised infusing 0.9% normal saline, 2000 ml within 24 hours. How much ml per hour will you administer? I'll repeat the question. How much ml per hour will you administer? So the question is asking you only to calculate the milliliters per hour. So because we have asked the question for 24 hours. And the options are option A, 100 ml per hour, and option B, 150 ml per hour. And option C, 83 ml per hour. Option D is 90 ml per hour. What do you think that the best answer would be among this? I'll repeat the question for you. The doctor advised you to infuse normal saline of 2000 ml within 24 hours of time. How much ml will you administer? So I'm getting the question which has been answered. 69 people out of this have answered it correctly. I cannot say it. I'll show you the scoreboard once it is done. We just have got 15 seconds to answer this question. Make sure you will answer it correctly. Great going. We have just got 5 seconds more to answer this question. Again, the timer will be up to 1 and 0. Yes, here is the answer. So most of you have answered it correctly. That is 73 out of this. And the answer is C, 83 ml per hour. Let us see who is on the top score again. Amazing Yelk is not leaving the hope. And again, you would score the top position. Sturdy Elephant again on the second top. And Polite Cat is again on the top 3. Great. So let us see the answer. The answer is C, 83 ml per hour. The formula which we have used is total amount of fluid divided by time in hours. The total amount of fluid given in the question is 2000 ml. Number of hours the doctor advises 24 hours. That is why we have just got 83 ml per hour. So this is our answer. Let us get back to the same Josh of answering the questions. Come on. So this question is talking about the inotropes. It is about the injection dopamine. So let us see how you will answer this question. Injection dopamine 5 mcg per kg per hour is being advised. And this, the available dose is 200 mg, diluted in 500 ml NS, that is normal saline. And the patient's weight is 60 kg. You need to calculate how much ml per hour you will start infusing the patient. So again, I'll repeat the question for you. Injection dopamine 5 mcg per kg per hour is being advised. And the available dose is 200 mg. And the dilute, it should be diluted in 50 ml of normal saline. And the patient's weight is 60 kg. And here I have just given you the hint also. It is dopamine. You need to use our inotrope calculation formula. So the hint is here. Within 30 seconds of time, you need to answer the question. Then the options are option A, 4 ml per hour. Option B, 4.5 ml per hour. And option C, 5 ml per hour. And option D is 5.5 ml per hour. So what do you think that the best option would be out of this? If you have rightly applied your formula, you should not miss a single zero also, either if your answer will be going wrong. So the doctor advised again, 5 mcg per kg per hour. You need to calculate ml per hour. Just got 2 seconds to answer this question and the time is again up. Let us see who have done it correctly. Only 37 out of this have done it correctly. And the answer is B, that is 4.5 ml per hour. So let me show you who is on the top score again. Amazing Elk is not leaving the first top position. Sturdy Elephant again scores the second. Polite Cat is again on the top 3. Rocky Leopard is on the 4th. And Legend Raven is again the 5th position. Congratulations, everyone. So this is the answer. The answer is option B, 4.5 ml per hour. And the formula which we use for the inotrope calculations is required dose multiplied by stock volume multiplied by patient's weight into 60 minutes. So because we infuse within 1 hour. So it will be stock dose divided by stock dose multiplied by 1000. And the required dose here is 5 mcg, that is micrograms. And the stock volume is 50 ml. And the patient's weight would be 60 kg. And the time is 60 minutes. And then stock dose is 200 mg. And here we get the answer of 4.5 ml per hour. Congratulations. Let us know that this is a type answer. You need to type the answer in this. There will be no options for this one. So let me read the question for you. Syrup ascorbyl 30 mg is advised. I repeat the question. Syrup ascorbyl 30 mg is advised. And the available dose is 90 mg per 15 ml. 90 mg per 15 ml is the available dose. How much will you administer? So what is your best answer out of this? You need to type your answer in this box. If not, the answer will not be taken. You need to see how much AML will be your answer. Please also type ML along with the number or the numeric that you think about. You just got 40 seconds more to answer this question. Make sure you will answer it correctly. I'll repeat the question for you. Syrup ascorbyl, 30 mg is advised, and the available dose is 90 mg per 15 ml. How much ml will you administer? Come on, faster. You need to answer this question. You need to type your answer in the box which has been given. You just got 25 seconds to answer this question again. Out of this, we can see 75 people are answering. Great, good going. Don't lose hopes. Please do calculate and do answer it. So don't make any mistakes, because the right answer is also onto the top scorer. So you just have 3 seconds to answer this question. 3, 2, and 1. The time is up. Great going. So here I can see many answers. Yes, the review answers are, so many answers are there. Yes, out of this, 43 has answered it correctly, 5 ml, and the acceptable answer is only 5 ml. So let me show you who is on the top score again. Amazing. Yeah, again, congratulations, you're on the top. Sturdy Elephant is again on the second. The rest, again, this Shining Squid has come on the 5th position. Please don't lose hope. Please play well. So let me show you the answer. The answer is 5 ml. So here the required dose divided by stock dose multiplied by stock volume divided by 1 as the formula for liquid calculations. As it is syrup, we have used the liquid calculation. So the required dose is 30 mg, stock dose is 90 mg, and stock volume is 15 ml. So the answer is 5 ml. Great going. Make sure, in case if you want, you can take a screenshot of this for application. Let us have the second last question. For this, to infuse injection pan 40 mg diluted in 100 ml of NS within 2 hours at a drop factor of 20. How do you calculate the drip rate? I'll read the question for you again. To infuse injection pan 40 mg, which is being diluted in 100 ml of NS within 2 hours at a drop factor of 20, and you need to calculate the drip factor. So the options are option A, 15 drops per minute, and the option B, 16 drops per minute, option C, 17 drops per minute, option D, 18 drops per minute. What do you think that the best option would be? You need to calculate only the drip rate, means nothing but the drop rate. Or GTT, you need to say. GTT is also called as drop rate. So you can either call it anyways. So you need to just calculate how many drops per minute you will infuse for this 100 ml of NS within 2 hours with a drop factor of 20. Choose the best option. I'll repeat the options for you. Option A, 15 drops per minute. Option B, 16 drops per minute. Option C, 17 drops per minute. And option D is 18 drops per minute. So here I have given you the hint. I just wanted to give you the hint within just last 5 seconds. You need to apply the formula of fluid calculation here, because you need to calculate the drop rate. The time is again up. Great, 93. Out of this, 55 have answered. Okay, 15 have answered correctly. Really bad. Okay, but not still, don't lose the hope. And let us see how good you will go with the next questions. Let us see who is on the top again. Oh my God. So poor, amazing, yeah, gone into the second position. Polite Cat has come into the top position. Great going. And let us see what is the answer. That's 17 drops per minute. And we have used the formula called for the fluid calculations. This total amount of fluid multiplied by drop factor whole divided by time period in minutes. We have different types of formula you can apply, but still the answer would be 70 drops per minute. The total amount of fluid which we have got is 100 ml, and the drop factor is 20. And the time period here we got is 2 hours, which can be multiplied by 60 minutes. So we will get 120 minutes as the total answer. We get 17 drops per minute is your answer. Congratulations for those who have rarely answered this question. So let me show you the next question, which is having a double score for your points. So here the question comes again about the BMI calculation, that is body mass index. So you need to apply the BMI formula. And for your easy understanding, we have given the question in this way. A patient weighing 80 kg and 162 centimeters. In meters, if we convert it, it is 1.62 meters. The he's this tall and is admitted to the general ward. You need to calculate the BMI of the patient. And your options are option A, 25.5, option B, 30.5, option C, 35.5, and option D, 40.5. Among this, what do you think is the best option out of this? You need to apply the BMI formula for this calculation. I've just given you the hint, and the question is so directly asked. And the patient is weighing 80 kg, and in centimeters to meters, if we convert, it will be 1.62 meters. It's easy just to apply that in the formula and to get your answer. I'll repeat the options for you. What is your option? Option A, 25.5, option B, 30.5, option C, 35.5, and option D is 40.5. This will be the last question for this round 3. Make sure you will answer correctly. Congratulations, 88, 89, 90, 91, and the time is up. So here the answer is, among this, the 58 people have answered it correctly, and the option is 30.5. Great. Let me show you who is on the top scoreboard. Amazing Yelk is on the top score, and it is a polite cat again on the top 2nd, and sturdy elephant is on the top 3, legend raven is on top 4, and shining squid is on the top 5. So here, as we got few tie, we have got the tiebreakers also. Answer is B, that is 30.5, and the weight in kgs divided by height in meters square is the formula for BMI calculation. As in the question, we have given 80 kgs as a weight, and the height is 1.62, which has been converted into meters. If we multiply it meter square, we get 2.62 meters, and the answer is 30.5. So here you go. So we have just got the tiebreakers. Let's break the tie for this. We have just got a few more questions for you to break the tie. This is the additional score which you get. You noticed overdamping of arterial waveform in the monitor. You just got 30 seconds to answer this question because to break the tie. You noticed overdamping of arterial waveform in the monitor, and following needs to be assessed by a nurse. These are the options which the nurse needs to assess. Which one is exceptional among this one? Option A, blood clots. Option B, air bubbles. Option C, kinking of catheter. Option D, level of transducer. You just got 3 seconds to answer this question, and the time is up. Rarely people have answered it correctly, and out of this, 18 people have answered it correctly. The answer is D, that is level of transducer. Let me show you who is on the top score again. Oh my God, the top 4 have gone to the same one, and only Rocky Leopard has come onto the 5th. So let me show you the answer. It is the level of the transducer, and the overdamping of arterial waveforms indicates the presence of blood clots. That is where the air bubbles and air kinking of the catheter will be seen. That is why you have to level up the transducer, except that. Okay. So here's the next question for you. If the blood bag contains gas bubbles, it indicates what? You just got 30 seconds to answer this question. If the blood bag contains gas bubbles or the bubbles inside it, what does it indicate? Option A, bacterial growth. Option B, hemolysis. Option C, RH incompatibility. Option D, and fluid overload. You just got 10 seconds to answer this question. Make sure you will be there on the fastest finger first, and you will answer it correctly also to score it best. So the time is up. We have just got 47. Oh my God. So only 19 people have answered it correctly, but 47 have answered wrong. Okay, let me show you the scoreboard. Oh, the game has changed again. It's a game changer, really. So Rocky Leopard, who is on the 5th position, have gained the 2nd position, and Amazing Yelk again onto the top score. The answer is A, bacterial growth. The survival of bacteria and the red blood cells may produce gas. That is why it results in the unnecessary and unusual air bubbles, which is so critical, right? So let me show you the last before questions. And the question is like this. A nurse is taking care of a hepatitis A patient, and the disease which can be transmitted through this. I'll read the question for you. A nurse is taking care of a hepatitis A patient. Among the options which can be transmitted through this, and the option A is sexual contact, option B, blood transfusion, option C, drug use, and option D is contaminated food. Among this, which will cause hepatitis A? How does this transmit? It's got 3 seconds more to answer this question. Come on, you're going great, and the time is up. So we just got 32. 42 out of this have answered it correctly, and the answer for this one is D, contaminated food. So who is in the top score? Oh my God, amazing. Yelp, you went down. So the Rocky Leopard has gained the first top position, and the Legend Raven again scoring the third. Creative Goat on the fourth, and Polite Cat is on the fifth. Let me show you the next one. So the answer is contaminated food. The hepatitis A will be transmitted through the fecal-oral route through contaminated foods. That's why the option is that. There's a last before question for you. High pressure alarms displayed in the ventilator indicates what? We get the high pressure alarms which will be placed when the patient is on ventilator. So what would be your best option out of this? Option A, anxiety. Option B, pain. Option C, increased secretions. Option D is tubing disconnection. What is the best answer for you in case if we hear a high pressure alarms on the ventilators? Option A, anxiety. Option B, pain. C is increased secretions, tubing disconnection. And the time is up. So most of you have said it correctly. Yes, 45 has said it is C option, increased secretions. Good going. And let us see the score. Oh, great. So Rocky Leopard is on the top again. An amazing Yelp, please score on the top. And the Creative Goat is on third. Great going. Let me show you the answer. That is increased secretions. High pressure alarms is caused due to any obstructions in the airways. So let me show you the last final question before this. And the question is, which is the complication of central venous access? When you access the central veins, which is the most common complication? Option A, pneumothorax. Option B, aspirated pneumonia. Option C, pleural effusion. Option D, atelectasis. You just got 0 seconds to answer this question. So 41 people have answered the correct answer. Great going. Superb. And the answer is A, that is pneumothorax. Arterial puncture, hematoma, and pneumothorax are the most common mechanical complications during the insertion of central venous catheters. I know everybody were just watching out for the scores, and the scoreboard I'm going to show you after congratulating everyone. So don't feel low. So firstly, let me congratulate everyone to the top 5 winners, which I'm going to show you after this slide. Okay. Are you ready to see? Before this one, I just have got one main announcement for you. Join us every Thursday, Facebook Live at 3 p.m. for more and more exciting webinars and the quizzes. And do take a selfie with your quiz group. And do hashtag Yashoda Hospitals Nursing Education and Training Webinars or hashtag Yashoda Hospitals on your social media. It may be Instagram, Facebook, or LinkedIn, whatever social media group it might be. So make sure that you will keep it interesting that you have participated in this one and win exciting prizes also for this. So I do repeat it, please do follow us on the Facebook page, and you do hashtag Yashoda Hospitals, and follow us every Thursday at 3 p.m. for the more exciting quizzes like this and also the webinars. I congratulate everyone. Everybody are just waiting to see who is the winner. So let me see in the Facebook chat section also who are the top winners. Whom do you guess? Are you exciting? Yes, everybody are excited. I know. I'm going to show you last coming one. So here is the semi-finals top 3 winners out of this. The top 3 is Shining Squid, and top 2 is Amazing Yelp, and top 1 is, come on, yes, Rocky Leopard. Really sorry, Amazing Yelp played well, and the runner-ups are Creative Goat and Polite Cat. All the top 5 will be going for the finals on January 12th of 2023. Let us welcome Happy New Year and Happy Christmas, everyone. And thank you for joining us today. We really loved it playing this game. Congratulations, everyone, and hope you were all excited and to have these types of quiz more and more on Yashoda Hospitals page. So do follow us for the next coming up webinars. Over to you, Amar sir. Thank you, everyone.
Thank you, Pratusha. It was an excellent quiz competition, and it was very interactive, and you made it very clear and simple way. And hope you all participants enjoyed it. And I congratulate Rocky Leopard for being in the top. And I welcome all three groups into the semi-final. And as she said, we are going for the final 12th January. We'll come with new year, new energy, refreshment, and excitement for the final. So thank you, and please be updated onto the Yashoda Hospital page. Thank you. Facebook.
Congratulations, everyone. We are just going to see that you will join us for the finals, and we'll try to contact you for this. And there are exciting prizes. Please do work on the rest three, which we have mentioned the rounds in the next coming up webinar. So make sure you will just stay tuned with Yashoda Hospital's Facebook page, Nursing Education and Training webinar series. Signing off. Thank you so much.